Good evening, ladies and gentlemen. So I'm slightly diverting from the topic that we were discussing so far. So this is an overview of the multiple things that an FS200 can do. So the most common that we're used to is the flap, and the specialty of the FS200 lies in the fact that unlike the previous generations of laser, it calibrates for each PI, it calibrates for each eye that is done to account for the thickness change in the glass PI that may happen, or for any change in the environment or the fluence of the laser. It has a venting canal for air so that you have less of OBL in the interface. And the standard deviation for any flap that you may take is marginal, very minimal, 0.1 microns as far as depth is concerned, and 0.1 millimeter as far as the lateral deviation is concerned. And it takes a flap depending on the parameters that you have factored in at the most in 12 seconds. So you can see that is our old microkeratome at work. So I have speeded it up about twice as much, so not that I'm doing it this fast. So this takes around, with a speeded video, 12 to 13 seconds. On the other hand, when you come to the FS makes the flap in as much time. And what struck me most, so when Rohit had got his FS, I just came to see him, and what struck me most was how crude the microkeratome flap looked in front of the FS, which had a very smooth bearing and could be lifted up very easily. So these are the parameters that we use for the flap. So you have the bed with 8 micron spots and 8 micron line separation, and for the side cut, 5 micron spots with 3 micron line separation, and 8 micron energy, which can vary between 0.79 and 0.84 when actually measured. So now what are the other things that you can possibly do with the FS? I also use it for keratoplasty, and this is for intact. So here in intacts, it basically takes a channel along with a platform. So you have a channel which is approximately half the size of the platform being there to make the incision, and also to ease the insertion of the intacts that you want into the channel. So you see the instrument going in there and expanding the platform so that the intacts can be factored in. As we know, the minimal depth in that region needs to be 450 microns, and as you push in the intacts, because there's already a plane that has been created, it moves in smoothly, unlike some kind of ruffling of the cornea that you may see when you do it manually. And once that goes in safe, it is stuck a further 1 to 2 millimeter into the channel rather than stay on the platform level, and you end up with a 10O MFN suture in that region where the incision was made to prevent further extrusion. So now the parameters that I basically use, you can see that the inner and outer diameters there correspond to the ring that you're using. So if you were using Ferrara, naturally it comes down a bit more closer to the visual axis. So besides this, you use higher energy. So you use higher energy for this compared to the 0.8 microjoules that we use for LASIK. When it comes to the intact channels, you need to use 1.5 microjoules, 1.4 microjoules. And so these are the changes that you bring about in the parameters, and therefore there is a slight increase in the time that is taken to create the channels. Now another situation is when you use it for keratoplasty. So now that is with the donor cornea in the artificial anterior chamber, and you can see how the laser cuts. You can see those small bubbles over there. I'm scared it will freeze again, so but nevertheless, those small bubbles in the anterior chamber there. So this shows that the cut has already been made there, and the other bubbles you see over there are underneath the PI. So that's a full thickness cornea cut that you're taking over there. Though the outer and the inner diameters may vary, you can keep it the same as well. Over here on the recipient cornea, you can see that you need to fit both the suction ring and the applanation PI, unlike only the applanation cone that you fit for the donor cornea. So again, it cuts in a similar fashion, but to a lesser depth than what you did for the donor cornea. And those bubbles you see there are underneath the PI. So now going to the parameters that you'll take, you can see that over here, you're cutting deeper for the donor cornea compared to leaving about 120 microns for the recipient cornea. So this basically removes the, the superficial lamellae goes all the way up to the stroma, so that deep stroma, so that you just need to do minimal dissection to get to the Descemet's membrane. And then you carry on with your big bubble. Now again for DSEK, what I found that this takes so much less time. It does a lamellar cut all the way. So at a uniform plane, it goes lamellar, and you can go to the depth that you want your lenticule to take. For example, you want a 100 micron or 120 micron lenticule, you can factor in such a way that the residual corneal thickness from the donor cornea is that much. And that is very different from the approximately 15 to 20 minutes that you spend doing a dissection with the anterior chamber for DSEK. So this smoothened out the procedure so much, and you get much thinner flaps, thinner corneal lenticules when you do with the femtosecond laser. Of course, you should keep in mind that the donor corneal thickness may not be exactly what's mentioned in the chart that you get from the eye bank, but and you need to keep offsets for that. So these are some of the uses, and this is the parameter. So there again, you can see that the energy is changing from what we had used earlier. So we have come all the way from 0.8 microjoules to 1.85 in these cases. So basically, depending on the kind of treatment that you're doing, you can see that you can play with this instrument lot. Of course, it costs, but you also charge for the skill and the time that you spend to do keratoplasty in these patients. And instead, if you could use that charge, to divert to the PI, and you're doing it for one eye alone in the first place, I think this is a very useful tool as far as keratoplasty is concerned. Thank you very much.